At 50 years, you have erection difficulties, difficulty urinating, you pee several times at night, you have to consult a neurologist in order to take care of your prostate. Welcome to Objective Santé, your well-being channel. Will allow you to know the difficulty you will meet if you catch a sickness where you are only responsible. I'm Dr. Nature. I'm going to teach you the role of the natural. If you respect that rules, you will live better either going to any hospital in order to recover yourself. So, you visit a neurologist will try to know, to diagnose your sickness. There are several kinds of sickness, disease, which are caused that prostate. You can have prostatitis, you can have adenoma of prostate, you can have cancer of prostate. So you have to know exactly your sickness. So what you will do? The urologist will try to know the sickness. So we'll put his finger in your anus to assess the volume of your prostate. If your prostate is large, it's the prostate of adenoma. And when you realize that it's strong, it's hard, you will find that the cancer of prostate. So it will ask you to urinate somewhere and to go to the laboratory in order to check if there are infections there and the microbes which are in your urinate. If you have a difficulty to urinate, it will put a swab in your urinate in order to get out of the difficulty there. So you will start with pain and you will stay with that bag for a long time. It will ask you to go to the radiologist in order to check up the kind of the sickness. And you will try to know the quality of the sickness by a check, and it will ask you for a blood test to measure your PSA. So you will go to the laboratory to know the measure of PSA. From that exam, you will spend a lot of money, you will spend your time, and you will suffer, but it's normal. You refuse to avoid the difficulty, and when you are in the difficulty, you will spend money you will spend your time and you will suffer a long time. And and after that time, you'll try to know how to do. If it's infection, a microbe, it will give you a medicine in order to 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 cure it. If it's adenoma of prostate, it will surgery to remove the disease prostate. And it can't use radiotherapies or a chemical therapy or a surgery to remove the disease prostate. So you have to know you'll suffer in your body, you'll suffer in by spending money for the exam, and you will spend your time because you're always going from your dwell to the hospital. You haven't any time to work, you haven't any time to do something else because of the sickness, and you'll spend all your time. And after, when they will discover your sickness, it can give you the pill, the medicine, or you will do the chemical therapy, or you will do the radiotherapy, or you will use the surgery to remove the disease out of. You have to accept your situation. You have to suffer yourself without saying something else because you are the only responsible of your disease. So you have to avoid that. If you are a member of your center of Dr. Natu, I advise you to avoid that spend of time, spend of money for nothing. So thank you very much. So let's go to the last test video in order to say what to say exactly. So see you next.